Hi dear students, now back to the third session of the different routes of vaccination. We had mentioned in the previous sections about the oral, intranasal as well as the intramuscular and the intradermal layers. Now let's go to the next one, the subcutaneous layer. So you do remember the anatomy of the skin, and we see that you have the epidermal layer, you have the hypodermal layer, and you have the muscle layer. And I told you earlier, when you inject yourself through a 45-degree angle and in a deeper layer, okay, but not that deep, okay, not up to the muscles, but at wrong angles, but at a deeper angle, you could at an angle of about 45 degrees centigrade, you will reach the subcutaneous layer. And let's see how we have to do and what are the features of that. The subcutaneous injections, they are mainly used to administer the vaccines into the subcutaneous layer above the muscle and below the skin. It has an advantage that self-administration can be possible and depot preparations can be inserted, example the Norplant for contraception, but it has disadvantages because it is not suitable only for non-irritant drugs, okay, and the drug absorption has been found to be slower, and so in emergency conditions you cannot give a subcutaneous injection. But at the same time it has some advantages because subcutaneous administration allows the therapeutics to be self-administered by the patients or the healthcare providers using a variety of drug delivery system, and SC administration facilitates patient self-administration even at home or outpatient clinical environments because not much of aseptic environment has been needed here, and it provides a reduction in the medical facility fixed costs. And it is reported that a 3-time reduction in the total preparation and administration which has been needed for IV administration is being found to be less for the SC administration. And while the risk of infusion site infection is still there with the SC administration, the infusion site infections are usually limited to cellulitis and very rarely progress to systemic infection. And moreover, the ability to administrate the injection at home reduces risk of exposure to hospital-acquired infections. What are the disadvantages that we have? You have some inflammation or irritation at the injection site sometimes. Leakage of the drug at the subcutaneous site could happen, and also sometimes allergic reactions can also be considered to be as disadvantages or hazards associated with the subcutaneous administration. And the site of administration also need to be rotated, and often there is a maximum volume of about 2 ml per site. That is, you cannot, now some of them will have multiple subcutaneous injections as a dose, and this could cause discomfort. And the slower absorption, as we had mentioned earlier, is a common disadvantage of this subcutaneous administration because there is less blood flow to quickly absorb the drug, and sometimes this may also be an advantage in that lower doses of drugs may last for longer periods. So I hope the entire session of the different routes of vaccination are clear to you. We had mainly we had the oral, the intranasal, the subcutaneous, intradermal, as well as the subcutaneous types of routes of vaccination.